Hi, I'm Dr. Katrina Iiams-Hauser, and I'm a naturopathic doctor. This is my first year to be invited to participate in this conference, and I want to say thank you to the Pierce County Survivorship Team for hosting this conference and for being persistent in spite of all the challenges that come with having a conference in this day and time. So thanks for inviting me to speak, and I hope all who are listening today, I hope you all get lots of useful takeaways from these talks. So a little bit about me. Evidently, I like to commute a lot and split time between my private practice in Linwood and Quaybill Clinic in Fife, which is owned by the Puyallup tribe. My primary focus is helping patients find and maintain their well-being by looking for the root causes of illness and removing obstacles to healing. Well-being involves finding and removing obstacles to healing as you go every day, both consciously, as in the choices you make daily, and unconsciously, like your cells repairing themselves after the stresses of the day while you sleep. There are 6 principles which help guide the practice of naturopathy, and today I'm going to share with you practical ways to live out these principles for your own best health and well-being. Just a quick note, any information given in this talk is not to be taken as medical advice. So here are the 6 principles of naturopathic medicine. They sum up our philosophy, how we practice medicine, how we think about healing. And while philosophy is interesting as a subject, most of us really just want to know what we can do to feel our best and have the highest quality of life. So let's dive in. First, do no harm. This principle, also known as the Hippocratic Oath, it's part of what medical students recite when they graduate and become doctors. The goal is to use methods and medical substances which minimize the risk of harmful side effects. That is doing no harm, or at least part of it. A couple other parts to doing no harm in a healthcare setting would be avoiding, when possible, the suppression of symptoms in a harmful way. Certainly, sometimes symptoms need to be suppressed, and we'll talk more about that later when we go into the therapeutic order and how we think about matching the force of the illness with the force of treatment. The third piece to doing no harm is acknowledging, respecting, and working with the individual's self-healing process. So we always start by listening with the intention to understand, so that the best course of action can be determined. So one way to do no harm is to really listen to yourself. Really listen and do a check-in. So I'd like to share with you what a wise woman once taught me, how to do a check-in that helps you to tune into yourself and can be useful for those in your life. I certainly use it for myself as well as my family and patients to check in. Oftentimes it quickly brings into focus what is, and therefore what needs attention. So the first question is, how does my body feel? Just in a word or two. So take a moment at home and answer that for yourself. How does my body feel? The next part of the check-in is, what is the state of my mind? So body, how's my body doing? Mind, where is my mind right now? And just a word or two to describe the state of your mind. The third part is heart. How am I emotionally in my heart? And take a moment here to check in as well and see where you're at, where your emotions are, where your heart is. So when we put it all together, we have the body, mind, heart check-in. And this, as simple as it seems, can really interrupt the cycle of doing and bring us into the present moment. Because the power of knowing where you are or where your loved ones are can both help to make necessary adjustments for the well-being of all and serves as a helpful communication tool. And most importantly, it does no harm. Identify and treat the cause. Identify and treat the cause is about finding and removing the underlying causes of illness rather than just eliminating or suppressing symptoms. And I love this picture because it really shows how little we can know about what is going on by only seeing from the surface. Finding the root cause requires consideration of the bigger picture. And you see here a picture of an elephant. And there's a parable, it's multicultural, there's stories from around the world that all come to this one parable. So the story goes like this. There's a group of blind men and an elephant, and none of the men had encountered an elephant before. When asked to describe what they felt, the man who had felt the tail said, "This must be a snake." And the one touching the ear said, "This must be some kind of bird because I feel a wing." Each man came up with different information from his limited investigation of one part of the elephant, which is why we have to gather enough information to make informed decisions. Even then, it can help to have an outside trusted person to help us see the whole picture and what needs healing. So it's summertime, one of those rare, really hot days, and hopefully you're not passed out on the grass like this guy, but you've just finished working outside and you have a raging headache. Let's say in your rush to get things done today, you realize you've skipped lunch and haven't had any water all day. So, first of all, congratulations on this realization. That's a good first step. So at this point, you have a couple of options. You can take a pain reliever, block the pain, and you'll probably feel better in the moment, but you won't have addressed the dehydration. That's probably the root cause of your headache. You can drink a glass or two of water, throwing in some electrolytes for good measure, or you could do both. You could take the pain reliever and drink the water. But either way, as long as you're drinking the water, you're getting to the root cause in this scenario. And if not, then that means we need to dig a little bit deeper. And that's also information that you can get from that trial. So the headache's a symptom. You can treat the symptom, likely to return if the root cause has not been addressed. And that's not to say we must suffer needlessly. Rather, if we understand the root cause, it helps to reduce suffering in the short and long run. Because even if a pain reliever is needed this time, next time, you might start to notice the signs and proactively drink more water. Or you look at the weather forecast and you see it's going to be in the 90s and you think, I better make sure I have water with me. Or even better yet, you have a practice of carrying around water with you all the time. All of those things are in our power to do to take care of ourselves. But sometimes we need to learn because we may not have been operating in the ways that are for our best health. We make choices based on lots of different factors. So bring awareness to the present, learning what you can do to bring balance. It all takes practice and often some additional learning. So this is where having a doctor as a teacher really comes into play. So doctor as teacher. Naturopathic doctors, we don't just believe it's our job to help people improve their health, but also to educate so they can be responsible for their own health as well. And encouraging self-responsibility, it's just a major goal for a naturopathic doctor. That said, you are really the best expert on yourself, and any doctor is there to help you learn how to interpret those signals that your body is giving and help you learn what to do to regain wellness. And ideally, that's something that, especially if it's an ongoing issue or something that you learn about yourself that can happen when, for example, you're under stress. Perhaps you get eczema or you have a flare-up in some way. But if you know what you can do to quell that or even start to see the signs before that happens, it is a place of power to be in. So I'll say one of my greatest joys as a naturopathic doctor is having patients come back and tell me that they were able to short-circuit a headache or flare-up by noticing and listening to their body's signs and taking appropriate action to rebalance. So, in keeping with our theme of practical applications of naturopathic principles, I'm going to demonstrate doctor as teacher and introduce you to the therapeutic order. This is how we match the force of treatment to the force of the illness. You can see at the bottom of the pyramid, we have established the foundation for optimal health. And those are just all the things that keep us well. Looking at it includes finding and treating the cause, and looking at all the determinants of health, the things that keep us well, our diet, our lifestyle, our practices. As we move upwards, we get into higher forces of intervention, which at the very top is suppression of disease. And on its face, that sounds pretty good, push down the illness. But while this is necessary at times, and we're all very grateful, I'm sure, for the medical interventions that exist, like surgeries and medications, things that are on that level of higher force when we need them. It's important, and we're grateful to have them. But as this picture shows, most of healing and maintaining wellness is focused on the lower levels, with the sorts of things we do on a daily basis, like eating food and moving our bodies, being of high priority for focusing our energies. So as always, we have to weigh the risks and benefits of interventions, what we're going to do, what treatments we'll do. And as my dad always said, you don't need a sledgehammer when a hammer will do. So certainly we have access to lots of synthetic symptom relief or high force interventions, but not always the right tool for the job. So the next principle is the healing power of nature. The natural state of the body is health. And in so many ways, great and small, we are constantly finding balance. In scientific terms, homeostasis is the tendency towards equilibrium or balance in the body. And on the cellular level, electrolytes like sodium and potassium are regulated within a very tight range, with many checks and balances to maintain this homeostasis. If we pan out all the way to the level of the body as a whole, we can see how many systems come into play to bring back the balance when we have, for example, a fever. That's a great example of a body process. It's usually created in response to messages from the immune system that there has been a breach of the early warning systems, and the heat needs to be turned up to burn whatever it is out. And once the fever has done its job, more signals are sent to turn the heat off, and the immune and lymph systems gets to work on cleaning up the mess. And usually the person returns to good health again. This is a pretty straightforward story of the healing power of nature, though it is not always that straightforward. If you've been sick for a while, it may require more interventions and supports to stimulate the healing power within, and most importantly, more time. So the literal definition of the healing power of nature can be found in this picture. This is a picture of a woman who is forest bathing, which is a very popular practice, especially in Japan. It's going into a natural setting and just taking it in. So even 15 minutes a day can positively impact our well-being. And actually, they did some studies on this, many studies, in fact. And in 2017, they collected all of that published data on forest bathing, and they found that individuals living and interacting in green spaces report being more energetic, in good overall health, and having more of a sense of meaningful purpose in life. Current scientific findings are illuminating what humans intuitively know. Nature has great benefits for the human brain, and this is shown through increased happiness, health, well-being, and cognition. But you don't have to be near a forest to experience the healing power of nature. Growing a garden or a houseplant, even. I'll even go so far as to say visual images of the natural world brought inside may help reduce stress and promote well-being. Treat the whole person. The whole is greater than the sum of its parts. This is the concept of holism. And when we apply this to medicine, we think about all of the individual physical, mental, emotional, genetic, environmental, social, and spiritual factors that make up our whole being. What I have here today is what is called a wheel of health, and I use this personally as well as for patients to assess on a regular basis what's going on, how you're feeling in these different areas as far as how fulfilled you are, career, family, friends, your relationships, fun and recreation, health overall, money, personal growth, and physical environment. Those are all categories that are part of our health, and it can help to see graphically when you take the time to evaluate where you're at, how you're feeling in all of these areas. It can really give some insight in a very visual way to where you could use some support or where there's some areas for improvement. So prevention. Prevention involves assessing individual risk factors, heredity, susceptibility to disease, and making appropriate interventions in partnership with the patients to prevent illness. So, how does this relate to everyday living? Well, the actions we take daily impact our futures, and this is one place where we actually have power and choice in most circumstances. So, we have this beautiful picture of fruits and vegetables. Who doesn't love to look at a lovely, colorful picture like this? And truly, you are what you eat. So literally, the nutrients we take in help to build and repair our cells, our tissues, our organs, and our overall being. That said, when we talk about healthy living, a lot of emphasis is placed on diet. And truly, it is a cornerstone of our health, but it's not everything. I'll even add to this words and thoughts, because words and thoughts are things as well. And anything we take in, or anything that is present for us in our mind body, we must digest. So even information has to be digested. So some of the things we can do, especially in this day and time, is regarding prevention is, of course, our diet, eating lovely, fresh, whole foods and all of those good things, but also limiting the sorts of things that we're digesting that are difficult to digest, and giving ourselves time when we are encountering those to process them. So sometimes this looks like turning off social media or turning off the sources of stress, things that are making you feel more, just basically things that are hard to digest, we'll say. So one of the most mind-opening realizations I've had was how much breathing can impact your overall well-being. Now I'd say taking a few breaths is a way I can prevent saying things I don't really mean when I feel angry, or even while I'm eating. If I notice that I'm not really thinking too much, I can take a moment and breathe, and it can really help my digestion so I don't have cramps or unwelcome stomach troubles after eating. So just breathing can make that change. And the other thing that's beautiful about taking breaths is that it's there for you all the time. As long as you have your breath, you can take breaths. So today I'd like to take you through a little breathing exercise. So unlike the man in this picture who's lying down on his back, I'm going to ask you to sit wherever you are and put your feet flat on the ground and really feel your feet on the ground. And then once you're there, we're going to take about 3 breaths, and each of these breaths we're going to hold. We're going to inhale for 5 seconds, hold briefly, and then exhale for 10 seconds. So I want you to go ahead and inhale for 1, 2, 3, 4, 5, and then exhale 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Let's do that again. Inhale for 5, 4, 3, 2, 1, and exhale 10, 9, 8, 7, 6, 5, 4. Really feel the breath come out of your lungs all the way to 1. And then once more, inhale 2, 3, 4, 5. Exhale 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This sort of breathing actually helps to activate our parasympathetic nervous system. And our parasympathetic nervous system is the part that's involved with rest and digestion. It's opposite of the sympathetic nervous system, which is what causes us to fight or flight or freeze, actually. So something as simple as accessing your breath can help to bring your body into that parasympathetic state so you can rest, even if just for a short time. And I'll guarantee you that this practice, however you choose to implement it, if you do, can very much be preventive in terms of preventing escalating into emotions or saying things that we might not want to say to those we love. I oftentimes will use this breathing exercise while I'm driving and remind myself that all I have to do is be a very good driver on the road. And it helps when road rage comes up as well, to bring yourself back into that place, or traffic, to bring yourself back into that parasympathetic mode. All right, so that's it for today. That's all I have, and I just want to remind you that every day is an opportunity to make choices for your best health. And if you're interested to learn more about some of the materials or the things that I've spoken about today, you can connect with me, Quaybill Clinic, as well as my private practice in Linwood. So thank you for listening. I hope that today brings lots of good takeaways, and I wish you the best in your health and wellness.